Hello and welcome to our YouTube channel. Today, we're discussing a topic that affects many men as they get older, an enlarged prostate. Also known as benign prostatic hyperplasia, BPH. An enlarged prostate can cause a variety of uncomfortable symptoms, including frequent urination, difficulty starting and stopping urination, and weak urine flow. While there is no cure for an enlarged prostate, there are lifestyle changes that can help manage the condition and improve your symptoms. One important factor to consider is your diet. Certain foods and drinks can irritate the prostate and worsen your symptoms, while others may have a protective effect. In this video, we'll be sharing a list of foods to avoid if you have an enlarged prostate. While it's always important to consult with your healthcare provider before making any significant changes to your diet, these recommendations may help you manage your symptoms and improve your overall prostate health. So, without further ado, here are the top foods to avoid if you have an enlarged prostate. Number 1. Tomatoes. Tomatoes are a nutritious and tasty food that are rich in vitamins, minerals, and antioxidants. However, tomatoes and tomato-based products like tomato sauce and ketchup contain acid that can irritate the bladder and worsen symptoms of an enlarged prostate. If you have an enlarged prostate and enjoy tomatoes, there are a few ways you can still include them in your diet. Cook them. Cooking tomatoes reduces their acidity, which can help reduce irritation. Try using them in pasta sauces, soups, or stews. Choose low-acid varieties. Some tomato varieties are naturally lower in acid than others. Look for tomatoes labeled as low-acid or less acidic when shopping. Rinse them. Rinsing sliced or diced tomatoes in cold water can help remove some of the acid. Eat them in moderation. While tomatoes are a healthy food overall, it's important to be mindful of your intake if you have an enlarged prostate. Try to limit your consumption of tomatoes and tomato-based products to a few servings per week. Number 2. Soy products. Soy products are a source of plant-based protein that are popular among vegetarians and vegans. They are also a good source of nutrients like fiber, vitamins, and minerals. However, some studies have suggested that consuming high amounts of soy products may increase the risk of developing an enlarged prostate. It's important to note that the evidence on this topic is mixed and more research is needed to fully understand the relationship between soy and prostate health. Some studies have found no association between soy consumption and prostate health, while others have found a protective effect. If you have an enlarged prostate and enjoy soy products, it's generally safe to consume them in moderation as part of a balanced diet. However, it may be wise to limit your intake of soy or choose lower isoflavone varieties if you are concerned about your prostate health. It's also important to note that soy is not the only source of isoflavones. Other sources include legumes, nuts, and whole grains. It's generally recommended to consume a variety of these foods as part of a healthy diet. Here are a few more things to consider when it comes to soy and an enlarged prostate. Choose non-GMO soy. Many soy products are genetically modified, GMO. Choosing non-GMO soy products may be a good option if you are concerned about the potential risks of GMO foods. Opt for fermented soy products. Fermented soy products like tempeh and miso may have a lower isoflavone content than other soy products, and may be a good option for those with an enlarged prostate. Be mindful of serving sizes. It's important to pay attention to serving sizes when consuming soy products. Overconsumption of any one food or food group can lead to an unbalanced diet. Consider other protein sources. While soy can be a healthy protein source, it's also important to include a variety of protein sources in your diet. Other options include beans, lentils, nuts, and seeds, as well as animal protein sources like chicken, fish, and lean meats. Number 3. Processed meats. Processed meats are meats that have been preserved through salting, curing, fermentation, or smoking. Examples include bacon, hot dogs, deli meats, and sausage. Processed meats are typically high in sodium and preservatives, which can be harmful to your health. In particular, consuming high amounts of processed meats may increase your risk of developing an enlarged prostate. This is thought to be due to the high levels of saturated fat and sodium in these products, which can contribute to inflammation in the body. If you have an enlarged prostate, it's generally recommended to limit your intake of processed meats or avoid them altogether. Instead, choose fresh, whole foods like lean proteins, fruits, vegetables, and whole grains. It's important to note that not all processed meats are created equal. Some products may be lower in sodium and saturated fat than others. If you do choose to include processed meats in your diet, it's important to read labels and choose options that are lower in these nutrients. Here are a few more things to add. Choose lower sodium options. Many processed meats are high in sodium, which can increase your risk of developing an enlarged prostate. Look for options that are lower in sodium or choose fresh, whole foods instead. Look for healthier preservatives. Some processed meats contain preservatives like sodium nitrite, which have been linked to an increased risk of certain cancers. Look for options that are preserved with healthier alternatives like vinegar or celery juice. Limit your intake. If you do choose to include processed meats in your diet, it's important to consume them in moderation. The American Heart Association recommends limiting your intake of processed meats to a few servings per week. Consider alternative protein sources. There are many other protein sources to choose from besides processed meats. These include fresh meats, poultry, fish, beans, lentils, nuts, and seeds. Number 4. Fried foods. Fried foods are foods that are cooked in oil or fat at high temperatures. Examples include French fries, fried chicken, and donuts. While fried foods may be tasty, they are generally not considered to be healthy. They are typically high in fat and calories, and can contribute to a variety of health problems, including an enlarged prostate. Consuming high amounts of fried foods may increase your risk of developing an enlarged prostate due to the high levels of saturated fat and cholesterol in these products. Saturated fat and cholesterol can contribute to inflammation in the body, which may worsen prostate symptoms. If you have an enlarged prostate, it's generally recommended to limit your intake of fried foods or avoid them altogether. Instead, choose healthier cooking methods like baking, grilling, or steaming. Here are some things to consider if you really want to eat fried foods. Choose healthier oils. Some oils are healthier than others when it comes to frying. Oils that are high in monounsaturated and polyunsaturated fats, such as olive oil, canola oil, and avocado oil, may be better choices than oils that are high in saturated fats, like coconut oil or palm oil. Avoid reusing oil. When frying foods, it's important to avoid reusing oil. Reusing oil can lead to the buildup of harmful compounds that can contribute to inflammation in the body. Use alternative cooking methods. Instead of frying, try baking, grilling, or steaming foods as healthier cooking options. These methods can help reduce the amount of fat and calories in your diet. Choose baked or grilled options when eating out. When dining out, opt for baked or grilled options instead of fried foods. Many restaurants offer healthier cooking options that can help you maintain a balanced diet. Number 5. Carbonated drinks. Carbonated drinks, also known as soda or soda pop, are sweetened beverages that are carbonated with carbon dioxide gas. Examples include cola, lemon lime, and root beer. While carbonated drinks may be refreshing and satisfying, they are generally not considered to be healthy. They are typically high in sugar, calories, and artificial ingredients, and can contribute to a variety of health problems. For those with an enlarged prostate, carbonated drinks can be particularly problematic. The carbonation in these drinks can irritate the bladder and worsen symptoms like frequent urination and difficulty starting and stopping urination. If you have an enlarged prostate, it's generally recommended to limit your intake of carbonated drinks or avoid them altogether. Instead, choose water and unsweetened beverages like herbal tea or unsweetened coffee. Thank you for watching this video on foods to avoid if you have an enlarged prostate. While it's important to pay attention to your diet when managing an enlarged prostate, it's also important to remember that every person is different and certain foods may affect individuals differently. If you have an enlarged prostate, it's important to consult with your healthcare provider before making any significant changes to your diet. They can help you determine the best approach for managing your symptoms and overall health. It's also important to remember that diet is just one part of managing an enlarged prostate. Other important factors include getting regular exercise, managing stress, and getting enough sleep. By following a healthy lifestyle, you can help improve your prostate health and overall well-being. Thanks again for watching, and we hope this information was helpful. If you found this video helpful, please don't forget to like, comment, and subscribe to our channel for more helpful tips and information about health and wellness.